femur, the longest bone in your body. So we're going to talk about the femur. And again, when you're dealing with all these bony landmarks, they can be overwhelming, but start to organize them either by what you can see from an anterior view, a posterior view, what's proximal, and what's distal. Okay, so we're going to look at anterior and posterior of the proximal femur, and I'll just go down in order that they're listed here on the slide. So the first is the femoral head. Pretty straightforward. Your femoral head, you can see both anterior and posterior. It goes into your acetabulum to form the hip joint. Below the femoral head is your anatomical or femoral neck. So that's in dark blue here. Then you have the fovea capitis, which is where the ligament that attaches to your acetabulum resides. So if you have the opportunity to see a femur, it's kind of an indentation at the top of the femoral head. On the lateral side, right? So here's our lateral side. Lateral side, we see the greater trochanter, and you can palpate that on just below, about a hand length below your waist or your waist belt. You can feel your greater trochanter, and it's called the greater trochanter because many muscles attach there: gluteus medius and minimus. Then we have a series of lines and crests and tuberosities that you can see whether you're looking anterior or posterior. So let's just look at, actually before that, I forgot, the lesser trochanter. So we had the greater trochanter on the lateral side, and then you can see the lesser trochanter right here on the medial side. All right, then we get into the lines and the crests. Anterior view, 1, right below the femoral neck. You have the intertrochanteric line in light blue there. And just think of the names, right? Anatomy can be pretty straightforward. Intertrochanteric, so it's between the two trochanters, the greater and the lesser trochanter. Then we flip over to the posterior view, and we have the intertrochanteric crest. So you have to figure out line is anterior, crest is posterior. Then you have two kind of, or three actually, that form kind of a Y. All right, so the lateral side is your gluteal tuberosity, and that's the site of the attachment point of your gluteus maximus. And then you have on the medial side the pectineal line. And then this big ridge that goes down the length of the femur is your linea aspera, and that's the attachment point of all your quadricep muscle group. Okay, so let's flip to the second slide, and now we're looking at the distal portion of the femur, right? So we did the proximal, and now the distal. So you have your epicondyles, which are outside of the condyle, then the condyles, and then a few tubercles. So the condyles in light blue and green, right here, your lateral condyle and your medial condyle, are where the femur actually articulates with the tibia. So you look for your femoral head, you know that's medial, so the green will be the medial condyle, and your greater trochanter shows you where lateral is, and then you have your lateral condyle. So you're always looking at condyles. Go back up to the proximal portion to get your medial and lateral sorted out. You then have this intercondylar notch, and again, anatomy is pretty straightforward. Intercondylar, between the two condyles. You have your intercondylar notch. Then we have our lateral and medial, change colors here, lateral and medial epicondyle. So the epicondyle is on the outside, so you can see in this red and darker blue. And then the final point is your adductor tubercle. Adductors is the motion where the hip joint, the femur comes toward the midline. So it's going to always be on the medial side because those muscles will grab that adductor tubercle and pull that femur toward the midline. See you in class.